The differentiated care and treatment model has become necessary to free up space in our busy clinics by decongesting patients to other nearby sites where they can access the same quality of HIV care and treatment they receive in facilities. This will not only reduce the loads of care on our health system, but make it channel resources to those most in need.
Right from the onset of the establishment of the Institute of Human Virology in Nigeria, its vision has always been to be a leader in promoting quality health services, capacity building, and research through its International Research Center for Excellence. Now, in carrying this out, the Institute of Human Virology Nigeria has been able to support the Federal Ministry of Health and the National Agency for the Control of AIDS, NACA, in mitigating the AIDS of HIV through the working under the framework of the National Strategic Plan for Mitigating HIV. Now, one of the key principal things that we have tried to do in making this happen is looking at the patient first. One size doesn't fit all for all patients.
Under this model is the Community Pharmacy Initiative, Community ART Group, and Community Treatment Initiative, all implemented by the Institute of Human Virology Nigeria, with funding support from PEPFAR through the Centers for Disease Control and Prevention.
Patients are facing a lot of challenges in terms of transportation. This reduces the logistical challenges of going to the facilities to pick up drugs, going to the facilities for common tests that can be done at the community level. We've been able to do this because operationally, we try as much as possible to keep our budget very flexible.
It also reduces the time they spend in the facilities to receive their drugs and makes the entire process of care easy for patients.
What this does essentially is to take the treatment to people at the community in the comfort of their homes. People who were unlikely to actually access ART for one or two reasons.
This is a model that allows patients to have some level of personalized care. Similarly, with this model, a clinician does not have to see a patient if that patient does not have a need to see the clinician.
And then they return to the community and they meet at a venue that they have already selected within themselves, and then they distribute these ARVs for themselves.
As a result, overcrowding of waiting areas in the facilities are drastically reduced and feedback responses from patients are enhanced.
This initiative has really helped me in time of taking my intake of drugs. Initially, I was scared of coming to the hospital because the business I'm having, nobody to stay in my shop. Thinking of coming to the hospital to stay for hours before you get your card, before you see the doctor. They told me that they were coming to my place to bring the drugs and for me to start the drugs. I thought it was a joke, but when I saw them, it really helped me. And I knew that, look, this thing is really serious. Since when I started, I have really kept to it, and it has really helped me.
As a patient-centered approach, the patients decide where to go for their treatment with the guidance of the clinician on the options available, especially for stable patients.
I think it's a very, very good idea, and I pray that it will be extended to all the communities. That will help us a lot. Then another thing that I see, it has reduced issues of missed appointments, abscondment, and so on, because you don't have to go there and suffer.
If the patients are stable, have achieved viral suppression, and have been on treatment for at least 6 months to a year, they qualify for this approach. Freeing up spaces in very busy clinics has become important as we plan to enroll more people for treatment in our communities.
The impact has been, number one, we've been able to scale up treatment. It means that the hospitals are being decongested to create room for more people to be recruited.
Patients that are stable will be taking their ARTs with the guidance of the community pharmacists or peer groups. Peer groups become important when a group of 6 people collaborate to collect drugs for one another. In this case, one person can travel to the facility to collect drugs for others, which will save 5 people money and time spent to do. If this is done rationally and bi-monthly, it may take one person a year before visiting the facility essentially for their viral load investigation. This model is designed to be monitored from facility to the community. Already, we have people working in the health facilities and those who go down to provide technical assistance. In order to ensure valid record and data, there is requisition and utilization record keeping process and data. So a patient that is meant to pick up his drug from a secondary facility will have his drug pre-packed and sent to the community site so that mix-up will be eliminated and data will be up to date. There is also monthly reporting during meetings.
We are praying that that community ART system should sustain, because the longer it sustains, people will be very happy. You will see people even coming out to get their drugs if they know there will be no problem in the hospital, that you have to leave all you want to do in that house that day just because of clinic.
The Community Treatment Initiative, another model, takes the treatment to people at the community, especially to those who are unlikely to access ART. After initial assessment, they are commenced on ART for a 4-week period. Ultimately, they are linked to a nearby facility of their choice. The community pharmacy model is also being implemented. Here we have registered pharmacists. These pharmacists are trained on HIV treatment, adherence, pharmaceutical care, pharmacovigilance, drug distribution and storage, counseling, monitoring the success of treatment and other patient care. With this model, patients are able to access their drugs through community pharmacy of their choice, which are closer to them without necessarily going to the facilities. The models of differentiated care being implemented in Nigeria by the Institute of Human Virology Nigeria are reducing unnecessary burden on the health system and meeting the needs of people living with HIV.